Hello, my name is Citlali Gonzalez, and my title is Negative Consumer Satisfaction Leads to Negative Outcome. I am a Health Services Administration student at Santa Fe College, and I'm also an intern for the Chief Quality Office of a hospital. According to BOM 2024, did you know that 80% of healthcare appointments are made by phone? They have also found that the healthcare appointment process is lengthy and challenging when using automated machines and life support. Importance and relevance. My quality improvement plan is important because by enhancing the quality of care, the hospital can reap benefits like profitability, improve health outcomes, and patient staff retention. BOM 2024 explained that a quality improvement plan can address the increasing number of consumerism in healthcare. Also, since patients are leaving for facilities where their standards are being met, this quality improvement plan can create more options for enhancing their healthcare experience. My propose my purpose is to demonstrate to the hospital leaders my quality improvement plan that will provide tools to better their consumer satisfaction. My recommendation is to have awareness of the impact that limited options and bad healthcare experiences can have on consumer satisfaction. By providing a quality improvement plan, I can raise awareness so there will be more effective leaders who can prevent future cause and effect problems. Agenda. In this presentation, I will discuss the issues associated with negative consumer satisfaction, my quality improvement plan for elevating patient healthcare experiences, and how implementing this plan can provide benefits for all. Healthcare appointments by phone issues. According to BOM 2024, U.S. healthcare facilities are allocating most of their money to patient portals and are overlooking their phone services. While appointments can be made on patient portals, most are done through phone. This can cause negative consumer satisfaction if healthcare facilities are not improving their phone services and do not know their consumers. According to EXL Services 2016, an organization has to know who its consumers are to understand if they are likely to participate in their products now or in the future. If an organization does not reach out and connect with their consumers, there can be a reduction in SMS reimbursement rates, patient loyalty, and physician retention. Relevancy to the hospital. We have an abundance of Medicare patients who, due to being non-tech savvy, can have a harder time scheduling appointments through the patient portals. BOM 2024 expressed that scheduling an appointment can take an average of 8 minutes due to difficulties caused by automation and the long wait times for live healthcare personnel. This can lead to negative consumer satisfaction, which then impacts our SMS reimbursement rates, and this can cause the hospital to lose Medicare patient, which can influence the skilled physicians to leave to other facilities. Solution for consumer satisfaction improvement. Create a smart aim. My aim is for the hospital to improve its consumer satisfaction rating by reducing its phone services issues by 30% using my quality improvement plan. The quality improvement tool for reaching smart aim is a fishbone diagram. According to SPAF 2021, page 233, by using a fishbone diagram, the quality improvement team can state the initial problem clearly. If it is stated too unclearly, then the causes can be harder to identify. The causes can be placed in categories to make it easier to comprehend. The diagram can help show why our consumer satisfaction is low and how it links to the phone services issue and others. After this tool has been used, SPAF 2021, page 146 recommended that using quality indicators can help determine the effectiveness of the diagram by providing us with statistical measurements that will allow us to compare consumer satisfaction ratings before and after the quality improvement plan implementation. All Abri and all Belushi 2014 also explained that to reach our smart aim, implementing questionnaires can help to receive firsthand experiences about how satisfied patients are with the hospital and its resources. This has been the most reliable measurement tool for obtaining patient feedback to implement changes. Implementation of quality improvement plan. Look at the hospital's demographics to see the ages of most patients. This is important to determine if the delivery method of the questionnaires need to be altered due to age-related problems. For instance, elderly patients will receive the questionnaires by mail and after in-person visits. However, since younger patients are usually more tech-savvy, they will be emailed to them. Patients will be encouraged to fill out the survey by stating that their suggestion can be utilized to make changes that will improve their quality of care, consumer satisfaction, and health outcomes. Likewise, they will be encouraged by stating that we care and want to connect with them. study. I expect the results of the questionnaire process to be good since it can provide data that can be analyzed. The data can be used to understand our patients and determine if the quality improvement plan is working. Although I anticipate good outcomes, some issues that I know will arise are patients not filling out the questionnaires and the staff not encouraging the patients to participate after their visits. Act. Based on my potential successful results, I plan on adopting this implementation plan. This can lead to questionnaires being sent out more regularly, and the hospital can know if their patients are being affected by certain issues. If so, they can make adequate changes like to their phone services and in turn increase consumer satisfaction. Benefits of the plan. According to Olabri and Al-Balushi 2014, one patient's satisfaction ratings signifies how strong communication is between the consumer and the organization. Because of this, surveys can be effective since they strengthen communication between the two parties and help us reflect on changes that need to be made to the hospital. Although one can use the patient survey data from other organizations to make changes, it would be less beneficial than it would be to use direct data from this hospital. It is important to understand your own consumers and their issues to provide a better quality of care and healthcare experience to them. Takeaway. It is vital that this hospital provide the surveys to effectively communicate with its consumers and gather data. This way, we can make changes that will benefit our consumers and not go based on other organization consumer suggestions. Summary and final recommendation. Summary of main points. With the use of quality indicator tools, the main problem of an organization can be identified. Next, the causes of the problems can be shown, and the improvement team can start to create an improvement plan to combat them. By understanding your consumers, it can determine what quality improvement plan to implement. After implementation, it can be monitored and analyzed to see if it is successful. Lastly, if it is successful, then the plan should be adopted to increase consumer satisfaction. My final recommendation is for the hospital to know that their patients' demographics, so that the delivery method of the questionnaires can be compatible with each of them. Although most hospitals have used surveys to measure consumer satisfaction, this hospital can improve upon the way they deliver these surveys. By doing this, there will be more patient participation, and we can apply their suggestions to increase consumer satisfaction. Any questions? Conclusion. To conclude, I think that it's important to state that if scheduled appointments are 80% made by phone, it is our job to reduce our phone services issues by 80% within the next few years, since it is an essential tool for our consumers. And these are my references. Thank you.